if you do everything right for the patient, but say, goodbye, it was nice knowing you, and they go off on their own, and maybe get their own doctor to prescribe the medication that's working on them, but they don't really see a headache specialist after that, they're likely to kind of drift back into trouble again. Because things might not go that well, and they'll pick up the same medicine that they overused before and ultimately overuse that. Or they might go to another medicine, but possibly overuse that. So if it's a patient that I'm taking care of, I say to them, I want you to keep a very accurate record of how much of which medicines you're taking, how often you have a headache, what type of headache is it. Today we use an app, an electronic calendar, as opposed to a paper calendar, but a paper would be okay. It's just that the patient has to record all of this. So when they come back to see me in a month or 2 months, I can look at with them what has happened. Because if they go away and come back to me in a month and I say, how are you doing? They say, well, I think I'm better. So how many headaches have you had? And they try to remember, and they can't. And how many of those pills that I told you it would be better not to take so much of, how many are you taking? And they don't really know. It's kind of garbage in and garbage out, and I can't really figure out what's going on. So follow up with good information from the patient that has been recorded is really essential in these patients.